Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to this episode of Health Talk. Today we have a topic that we're going to be exploring here, and we have Dr. Fleischer from Brookside Family Practice with us. She is an expert in the component of what we're looking to discuss here, which is diabetes today. And it's a major concern from healthcare to cost to health in general at this point. And what we wanted to do is start to give some light in some public information about how we can look to recognize some different things on diabetes, and then most importantly, how to prevent things. So, welcome, Dr. Fleischer.
Thank you very much for having me.
Absolutely. So the biggest question we have right now is there's a couple different things with diabetes. There's a couple different types. What is diabetes?
So, pretty simply said, diabetes is a metabolic disorder, which is a result of insulin resistance in most patients. And in some patients, it's about decreased insulin output from our pancreas.
Okay.
The result of that is an elevation in your blood sugars.
Okay. So when you're looking at diabetes and that type of stuff, and you hear there's some type 1, type 2, even possibly type 3 now, gestational, what are some differences between them?
So in the type 1 diabetic, that used to be called juvenile onset.
Yes.
It's where your pancreas doesn't make enough insulin or any insulin to bring those sugars under control.
Okay.
The type 2, formerly known as adult onset,
Right.
is a true insulin resistance. We have it, we actually have too much of it,
Okay.
and it causes the sequelae of events of inflammation and affecting of every organ system.
Sure.
We actually call it type 2 now because we're seeing children as young as the age of 9 being diagnosed with diabetes.
So it's no longer adult onset then?
Correct.
Okay. So maybe we should just kind of maybe explain a little bit of the physiology. I mean, so when we're talking about when somebody takes some food in, what kind of happens? Does it disappear into a black hole, or how does this insulin kind of factor into it?
So it depends on the type of food that you're eating.
Yeah.
Most of the time we ingest any kind of meal, it gets broken down into glucose.
Okay.
If you have a certain amount of glucose spike in the blood, depending on the quality of that sugar, the insulin will go up to help bring that sugar back down again.
Okay.
The effect that we want to see is one where the sugar goes up a little, the insulin goes up a little, they both come down to normal.
Okay.
So it's a little bit of a ripple effect throughout the day
Okay.
if you feed yourself every 3 to 4 hours.
So what's the primary reason for glucose? What does it do?
Glucose gives us all the energy that we need into our cells to function.
So if we don't have insulin to bring that in, hence
Well, if we don't have enough insulin to bring it up into the liver and into the muscles and out of the bloodstream, it's going to sit in the blood.
Okay.
That causes an inflammatory cascade, and it
Okay.
affects, again, almost every organ system.
Okay. So what is some of the signs and symptoms associated with diabetes?
So for many people, especially the type 2 population, they actually may not have any symptoms, which is a little bit scary when you
Sure.
think about it. But for many, it can be things like weight loss, fatigue,
Sure.
excessive thirst, excessive hunger, excessive urination. Sometimes you can have numbness and tingling, and for men they can present with erectile dysfunction.
So lots of different things is affecting many different systems at that point.
Correct.
Do we have any idea what the prevalence is on like a national average and maybe even on a state level? What do you actually see in your office?
So in the office, I'd say about 75% of my patients have some form of diabetes, whether it's pre-diabetes or diabetes proper. Nationally, it's about 175 million people.
Wow.
And in the state of Pennsylvania, I believe the most recent data was about 35% were either pre-diabetic or diabetic.
Right. So when we're looking at, some of the stats that we're looking at some of the different things that the world is projecting. They're saying, that we can go from 171 million to possibly 366 million within a short 15 years at this point. Is that pre-diabetic group that you're looking at, and how
Yes.
those numbers would be kind of determined at this point?
Absolutely.
Okay. So if a patient presents to your office and they come in with some itchiness between the fingers or some pins and needles into the hands, and you're thinking diabetes, what's the standard workup and what do you typically do with that patient? What can they expect?
At first, you start with the history. You ask them a little bit more about, what they've been doing in their lifestyle, how long have the symptoms been going on.
Sure.
You look for their family history because there's been some link in the genetics, although it's not all inclusive.
Sure.
And then you do a physical exam. Usually the physical does not show us a lot.
Okay.
There's some misconceptions about that the public thinks that we're gonna see something in them. And then it's as simple as a blood test.
Oh, okay.
Most of those blood tests we can do right in our office, so people don't
Okay.
even have to go to the lab to get
To get them
tested.
done.
Yeah.
Okay. And what are you specifically looking for in those blood tests? I mean, is there specific blood tests that you're looking for that give you direction on how that case would be managed?
So the first thing we'll do is a sugar level.
Okay.
If their sugar is fasting, it has a certain goal. If they're not fasting, it has a different goal. Because
Okay.
obviously if you're not fasting, the sugar should be a little bit higher because it's
Okay.
in your blood after you've eaten.
Right.
We also do a marker called a hemoglobin A1C,
Right.
which is a marker of how high your sugars have been in the last 3 months.
Okay.
So a lot of times my patients will come in saying, I've been behaving, here's my sugar log.
Right.
But behaving for a week and showing me a week's worth of numbers is not an actual representation of what the last 3 months have been like.
Okay. So is A1C a better indicator of the health of that patient rather than, we'll say, just a regular glucose test?
Yes.
Okay. So when you hear many people who are diabetic and they're saying that they're following the A1C level at this point, what is a standard number that you would like to see that in, and what type of number do you see that with most diabetics?
That's a great question.
Yeah.
So the diagnosis of diabetes comes at 6.5.
Okay.
We'd like to see everybody under 5.7.
Okay.
So the pre-diabetic population is the one at real high risk that if we don't change what we're doing now, they're going to turn into those 6.5
Is there a
and higher.
range that you're looking at? Is that like
The-
5 and above, did you say?
About 5.7
Okay,
and
5.7.
above to 6.4.
Okay.
And so I've seen patients as high as 12 and 13, and that's the poorly controlled. They're usually a lot older patients.
Sure.
But the average, I would say, is somewhere between 6.5 and 9 is that population that we're seeing pretty frequently in the office.
Sure. It's very interesting. So when we talk about like diabetes and that type of stuff, and you're talking about how we can like internally look at them and see what their health is this time. I mean, is there any way to think about even prevention? Because there's really no cure for diabetes. Is that correct?
Well, there is a cure
Okay.
for type 2 and
All right.
for prediabetes.
Okay.
And there's some other diabetes. There's the gestational that you mentioned
Right.
with pregnancy. But the treatment is also the prevention. Prevention is maintaining a healthy body weight,
Okay.
eating 6 small, low glycemic meals a day, having a regular activity, getting good sleep, which is important to our weight control.
Sure.
There are medications that treatment-wise, there's medications we can use, but often the prevention revolves around lifestyle choices that we're making on a daily basis.
Okay, so we know that this in the state of Pennsylvania, I think, costs like $250 billion, or I'm sorry, that's on the national level, $250 billion a year. I think on the state level, it's somewhere around $13 billion a year for a diabetic patient. So with that being taken into consideration, with prevention, we could eliminate a lot of those costs?
Significantly, if not
So-
remove them completely.
So we need to expand on that. So what is prevention then? I mean, I know you kind of just gave some little bullet points there, but what would you recommend?
So, I think the Medical Society has the sick care in mind,
Sure.
meaning somebody comes in with a high sugar and is diagnosed with diabetes, they throw them on a pill or a prescription, which doesn't treat the underlying cause. It treats the symptom, which is high sugar.
Right.
I also work as a certified health coach.
Okay.
And as a health coach, I help people treat the underlying cause, which is get down that insulin resistance.
Sure.
So we educate people on fueling their bodies throughout the day, kind of like adding kindling to a fireplace
Sure.
to keep it roaring all day long.
Right.
Eating small 6 meals a day is going to keep their sugars balanced.
Sure.
Activity level, our society is much less active than it ever used to be. We're doing everything automated and by robotics, so maintaining more activity, and it doesn't have to be aggressive activity, even 15 to 30 minutes of daily movement will help maintain the blood sugar.
Sure.
Getting good sleep, of course, is also very important to controlling our weight,
Right.
which is related to the sugar.
So when you're looking at, expanding it a little bit even into what people are eating at this time, I know you're saying given 30 minutes of exercise. Is there a pattern that people should be thinking when you say 6 small meals a day? Should that be protein and carbohydrates balanced at each meal? Should that be, starting to think about whole food, whole
Right.
grains versus, refined pastas, those type of things?
Yeah, in fact, when we look at the data, the diabetes incidence went up from 1980 to 2014 fourfold.
Okay.
And most of this correlates directly to the introduction of high fructose corn syrup.
Okay.
So we have easy access to food. The food is very cheap in terms of dollars. It's also cheap in its nutritional value.
Okay.
So everything's supersized. And
Sure.
now we're becoming supersized. And so if we can eat what we consider a low glycemic, which again is something that doesn't let the insulin level spike high, all right? So the whole grain pastas, your low carbohydrate type vegetables and fruits.
Sure.
And you pair it with a protein, which takes longer to break down into glucose.
Sure.
It will maintain that steady state of your sugar level in your blood.
Okay.
Most of the meals, especially breakfast, is the most important meal of the day.
Interesting.
So if anybody's going to make one change after watching this, they should eat breakfast within 30 to 60 minutes of waking up.
How about that?
If they don't eat breakfast within that time frame, their sugar will start out high and will stay high all day long.
Do you have any familiarity with the Mediterranean diet? That sounds what you're explaining is, it sounds like, a little bit of fish, some good oils, those types of things, fruits and vegetables and that type of stuff.
Yep.
And then bringing into more of the whole grains per se rather than
Correct.
refined.
Yep.
Sounds similar to what they have been recommending as well.
Yep. I think that the two things are the quality of the food you're bringing
Yeah.
in. So your protein is going to be your fish, your egg, your meat products
Right.
mostly. That's going to be anywhere from 4 to 7 ounces of a protein in your largest meal of the day. Your vegetables are going to be the next biggest portion of your intake.
Gotcha.
And then you're going to do a smaller carbohydrate and not always have a carbohydrate.
Absolutely.
As long as we balance your carbohydrate intake with a protein, again, you're going to see a balance in the sugar
Sugars.
level.
So we're coming back to like our signs and symptoms we were talking about, some different things, pins and needles into the hands, excessive peeing, excessive thirst and that type of thing. If somebody chooses to ignore that and chooses not to do any treatment with it, whether it's prevention or, we'll say behavior modification or medications at this point, are there consequences to that?
So there's significant consequences. In fact, in the United States, diabetes is the #1 cause of blindness, renal failure, and amputations.
Wow.
It also has a significant increase of cardiovascular disease or coronary artery disease, which leads to heart attacks
Sure.
and to stroke.
Wow. So now you're talking about a couple of the #1 killers in America that it has maybe its hand in as well.
Correct. Absolutely.
So it's amazing how, how brutal this disease can be, but also how preventable it can be as well. So it sounds almost like it's a behavior modification type of disease that we have to think about as well. So with all that being said, everything that we've been giving to, I want to come back to one other point, and it goes back to the physiology again. What happens to the sugar when it's free floating? What does it do to nerves?
It actually affects the function of those areas. It causes more inflammation.
Okay.
And so the nerve endings start to die off, and that's when people start to get numbness and tingling,
Gotcha.
which eventually leads to no feeling.
Wow.
And that's why people, their diabetic has to go see their foot doctor, and they think it's not that important. But if
Right.
you can't feel the bottom of your foot and you step on something, you increase your risk of infection,
Gotcha.
which then eventually, completely untreated or ignored, leads to the amputations.
So with all the information that we've given, and all the public health that you've just kind of, we'll say, shed some light on, what's your take-home message out of all this?
You know what? I think we can completely change the outcome of what diabetes is in this country. We need to take control of our own health. We need to think about not treating a disease, but creating health moving forward and having a goal in mind. We need to educate more physicians
Sure.
about how creating health is the new model as opposed to reacting to a disease state. There's a cause to this.
Sure.
It's our lifestyle.
Right.
It's maintaining healthy habits on a regular basis within a supportive environment that understands this.
Sure.
To have education, support, guidance, and a structure of how people can do this kind of on their own
Sure.
without having to use prescriptions that are, of course, extremely costly and have many side effects.
Sure. And so again, as we look at that, and you're just saying, it astounds me as we did this research here, and we're preparing for the show, how preventable it is. That's the most thing that I think that has stuck out to me the most as we started preparing for this episode as well. So Dr. Fleischer, I want to thank you for being here. It's been a pleasure. I think that, as we start to make this type of information more prevalent and people have a better understanding, you start to impact people's lives that become secondary to none.
Significantly so.
Absolutely.
Thank you.
Thank you very much. So, again, this has been an episode of Health Talk. Good day and good health.